Paediatric wards turned into emergency triage zones. Outside, the smell of dust and fuel mixed with the odour of burned concrete. Doctors Without Borders reported that trauma patients were being operated on without anaesthesia. The World Health Organization described the situation as unprecedented in modern humanitarian response. UNICEF, meanwhile, warned that children were now dying not from airstrikes, but from dehydration and preventable disease. As the world watched, aid trucks piled up in the Sinai desert, rows of white vehicles marked with red crosses and blue UN emblems, their engines off, their drivers waiting for the green light to move. Each truck carried enough food for hundreds of families. Each delay meant another day of hunger. The Red Cross and UN officials emphasised that humanitarian neutrality must be respected. "We are not part of the politics," Cardon explained. "We are here to save lives." His statement reflected a growing frustration among aid workers who had spent weeks negotiating access amid shifting ceasefire lines and military restrictions. In the diplomatic corridors of Geneva, the conversation broadened beyond Gaza itself. Officials from the European Union, the Arab League and the African Union joined calls for coordinated humanitarian airlifts. Spain and Norway pledged additional medical support. Switzerland, hosting the meeting, announced an emergency fund to facilitate border operations, but the question remained who would guarantee the safety of aid convoys once they entered the Strip. On the ground, the ICRC's local staff, many of them Palestinians themselves, continued their dangerous work. They cleared roads, repaired water lines, and evacuated the wounded from bombed neighbourhoods.